I think one of the appeals of sports medicine is the motivation of the patient. I think that a lot of times when you're a physician, you're dealing with almost two different entities. You have illness, you have injury. Sports medicine, while there is illness, we mainly deal from the orthopedic side with injury. And it's a highly motivated patient population with high expectations performance-wise of getting back where they need to be. All of them, from pediatric athletes, I deal with high school, college athletes, I deal with professional athletes, and I deal with older recreational athletes. And it's just really the motivation of the athlete that gets you excited. And you'll find a masters runner as motivated as a college or professional athlete to get back and do what they're doing. When you're working with high-level athletes, there's always that push for state-of-the-art medicine. And high-level athletes, whether it be college or professional athletes, are always looking for that next best thing. Well, everyday athletes are the same, and everybody wants the next best thing. And so you get into keeping your treatment plan, your strategy, your technology, your techniques always need to be state-of-the-art when you're dealing with high-level athletes, which benefits the everyday run-of-the-mill athlete. It benefits the recreational athlete, the high school athlete, because as sports medicine's physicians, obviously we provide the same type of care to everyone. I think that is one of the most important aspects of sports medicine, is to prevent the injury before it happens. Certainly we work on different methods to treat the injury, surgically, non-surgically, to get athletes over their injury, to get well and get back to performance. But most of it happens before the injury, through sports performance, through nutrition, strength training, neuromuscular training, conditioning. All those things are just vitally important in preventing the injury in the first place. I've always had a career goal of getting into academic medicine, and I've always told all of the partners I've worked with, the nursing staff and everything, that one day that was a definite career goal. The fellowship programs being started at the University of Kansas really was a big inspiration for me to do that. I've always had the goal of being involved in a fellowship, and that really comes from my experience as a fellow. After I was a resident, I trained with Bill Grana and Mark Pascal, and those two men taught me a great deal. And through that, I've always felt kind of the need or urge or inkling to pass on really their knowledge base to the next generation. And as I've gone through my career, I've been in private practice for 20 years, and I really hit the point where I thought, now is the time to do this.